My name is David Weiss. I am an associate professor in the Department of Health Professions and Family Studies. It's an interesting story about how countries or societies decide how do you meet a fundamental need of their population. The fundamental need of every population is how do you address health issues? How do you address education? How do you address housing issue? How do you address national defense? If you look around the world, different societies have come up with different ways of doing it. What can we learn from some of them? In some ways we can learn to borrow, but you have to remember each society is unique. It has its features that are true to itself and itself alone. We will not go into a healthcare system such as the English have. The English have a true socialist healthcare system, which means that the health facilities and the health providers, doctors, nurses, pharmacists, anyone delivering health services, are government employees. They are paid by the government. No one has ever proposed that for the United States. It is not going to be government run in that sense. The hospitals are not run, aren't owned. In England, they are. From that, as the English example, you get variations of it. You have a Canadian healthcare system, which is really very similar to our own, except in Canada, physicians are paid on a negotiated basis. They negotiate with government. They negotiate with the provincial government. Each year or every 2 years, there's a meeting between representatives of government and representatives of the various medical professions, the medical specialties, and they negotiate what the rates will be. But they are paid by each patient they're seeing at a negotiated rate. So each society has established something very, very different. Interestingly enough, the United States, and here's where some of the confusion comes in, the United States has examples of every single healthcare system in the world. Now, I just said we're not going to go into an English healthcare system where it's owned by government, but let me give you an example where exactly we do that. And in two areas where they're really very prized. Number one, the VA health system, the Veterans Administration system. Individuals who work for the Veterans Administration are paid by the federal government. They are doctors employed by the VA system, nurses employed, which is exactly what the English healthcare system is. Now, would veterans say, hey, let's attack the VA system because it's not doing us any good? I don't think so. Same thing true about the Medicare system. The Medicare system has the element of a Canadian healthcare system. Federal government collects the money that we pay into that system. We are paying for Medicare. They're holding the money. And then they give it out as we use the health services to the doctors that we say, hey, pay Dr. Smith for my visit. Dr. Smith has negotiated or has been told by Medicare, here's how much you will get for it. So there's elements of the Canadian healthcare system. There are elements of the British National Health Service, which interestingly enough, the Brits love their health service. And there are elements of the German healthcare system. The German healthcare system was the one that started the notion of health insurance. Interesting enough, coming out of Bismarck's Germany in the late 19th century, radical ideas such as workman's compensation, uninsurance, health insurance, disability insurance. These are ideas that eventually floated across the Atlantic. We've adopted them, and they become very common accepted practices for all of these societies. So it's an interesting diffusion of ideas and what should be part and parcel of how a society addresses certain needs. The needs that we're focusing on in this conversation are the health needs. But interesting enough, when you look at all of these and where the United States is particularly vulnerable and critical is in two areas. Number one, we exemplify the most expensive healthcare system in the world. We spend the most per capita, per person, of any healthcare system in the world. Now, most Americans say, well, that's really not that bad. That's okay. If what we would get for our investment is good health. Well, what do we mean by good health? We have certain standards of good health, such as how long do we live? How do we deal with such things as chronic illnesses? What about our infant mortality rate? And here's the kicker. When you look at those statistics, we don't look very pretty. In certain areas, we rank sometimes 37th in the world in certain indicators. Countries such as Costa Rica and certain countries that are not considered industrialized nations have better health statistics. So the fundamental question is, in terms of cost, what are we getting for the money that we're investing? What are we getting for the money that we're paying for these health services? If we're not getting good health, then what's the point? And that's been the concern. Are we getting for what we're paying for? It's not being translated in terms of health statistics, and that's a major concern.